I'm the owner of Sutton Place Physical Therapy. What's unique about us is we treat people both in the clinic, and we are the only facility in Manhattan that has a freestanding pool. So we are able to treat people both in the clinic and in an aquatic environment.
So for people who don't know, what is aquatic physical therapy? I mean, obviously it involves a pool in some way, but when someone says, "Hey, aquatic PT, what is it?" How do you respond?
It's actually just physical therapy in a pool with water.
So why is it so valuable? What do patients get out of it while they're in that aquatic environment that they might not get somewhere else?
Simply put, it's just easier to exercise in the pool. And what I mean by easier is for some people, it's not easy to exercise on land. It may be too painful for them. And so they end up not being able to exercise at all. So those are the people that tend to reach out to us because they're looking for uh, unique ways to be able to exercise that are pain free.
I love that. So you mentioned these people, right? A second ago, you said some people. Who are the types of people? Who are the types of people who have, different things going on with them that might be able to benefit from aquatic physical therapy? Just pick some of the types of people that come and work with you.
Good question. So, because we see many types of conditions, but the people that tend to search us out are um, many people with neuromuscular disorders because it's very difficult for them to exercise in a land environment. They have trouble exercising against gravity. And so that would be people that might have Parkinson's, ALS, multiple sclerosis, muscular dystrophy, the myopathies. They love coming to our pool.
You mentioned Parkinson's disease. What are some other issues people might have that they really benefit from the aquatic environment?
Well, we also see a lot of orthopedic patients.
Uh-huh.
So we'll have all the joint replacements. We have people that come after spinal surgery, any type of orthopedic surgery, ankle, knee, hip, shoulder. And then we have just people that have neck and back pain. Some of my favorite people to work with are people with balance issues. The water is one of the best places to work on balance issues because it's so safe there. When you work on balance on land, you're really limited to working with single leg stance, or tandem, working on, stepping over foam pieces, gait training. But people that are fearful, which most people that have balance problems are going to be limited in the pool um, because of some of the benefits of water, which I want to speak on next. You don't have the fear of falling, so we can really help people with balance problems.
All right, so let's talk about some of those benefits of the aquatic environment. When you're explaining this to someone who is a perfect candidate for aquatic physical therapy, what are some of the benefits that you highlight?
Water is so unique because of physics. And let me make physics fun for you. If
All
you
right.
remember, when you go into water, we tend to float. So there's that buoyancy. So when you walk into water, it helps support your joints. You walk into water and you get up to your neck, let's say, your body it unloads about 85% of your body weight. So if you have someone who has a hip fracture and it's very painful to walk on land, if they get in the water, they can walk without any pain at all. One of the other properties of water is known as viscosity. You may remember from physics. And all that means is water is about 800 times thicker than air. So just walking in water gives you resistance. So when we put patients in the water and they just walk back and forth, it's supporting them, it's working on their posture, and it's improving their balance just walking back and forth. Then another benefit is that big word, hydrostatic pressure. And all that means is the pool is like a giant Spanx. And for you guys out there that may not know what a Spanx is, it's like a girdle. And that helps if you have any swelling in your legs, or after a total knee replacement, people have a lot of swelling in their knees. You get in the water, and that helps so much to decrease the swelling. Another wonderful thing about the water for our patients, sometimes we have someone that's been in a car accident and they have had injuries in many parts of their body. They come to us with so much pain that they're not even able to start on land. We may have them come in the pool the first few visits just to walk in the water or lie on their back and move in the water gently. And then after a few visits, we transition them to land. So it helps with mobility and to decrease pain. So that was your simple physics lesson.
Perfect. That's some really, really great insight. Do I need to know how to swim to participate in aquatic physical therapy? It might seem simple, but it's probably something people ask.
Absolutely not. And I get asked that a lot. We don't have swimming in our pool. It's really just vertical and horizontal exercise. You don't have to even get your hair wet if you don't want to. And we don't have you wear bathing suit caps. You don't even have to wear a bathing suit. You do have to wear clothes. No swimming is necessary.
Now, here's a question. Could I do traditional clinic-based physical therapy and aquatic physical therapy at the same time? Do people do that?
Absolutely. We see many people that they're going to their own physical therapist. For example, we see a lot of people that are getting PT someplace else for total knee replacement, let's say, but they're just not getting the results that they should be at this point. So their PT has referred them to us, and they'll stay with their PT for their land, and they come to us for the pool just to get a little more work. We work together as a team.
Hey, I didn't prepare you for this. I'm going to throw you a curveball. You ready, Carol?
I'm ready.
Without using someone's name, but could you tell me a story about someone who came to you who was like the perfect candidate for aquatic physical therapy? They came to you, maybe they weren't sure about how it was going to go, and man, after they were done with you, they just had a really great outcome. Does anybody come to mind that fits that?
Oh, wow. Well, there's so many people that come to mind. I can think of someone who she had terrible hip pain, and she went from doctor to doctor and could not get relief. And she was referred to us, and she was having hip fasciculations, and so for the regular lay person, she was having twitching of her muscle in her hip. And when the therapist did her evaluation, she referred her for both land and we call it land and sea sometimes. And we worked with her because it was too painful for her to do physical therapy on land. We did manual work on land, got her in the water, and for the first time in 3 years, now she is pain free, and she is doing amazing, and she is one of our biggest supporters and refers a lot of patients to our pool program. So yes, she would
Love
be
that.
one of my stories.
Love it. That's a great story. Is there anything I didn't ask that typically gets brought up or asked of you when people are learning about aquatic physical therapy? Are there any frequently asked questions that I didn't get a chance to throw your way?
One of the things for older adults, because a lot of times we have uh, people, like a lot of our older adults, that don't want to get in the pool, or they think they don't want people to see them in a bathing suit, or they think, that they have problems with their balance or their gait, and they don't want to come in the pool. And some of the biggest problems I see, and you notice I say older adults, I don't like to say seniors, because I feel like aging is just, we're all getting older. And so we want to be the best that we can be. And we have so much fun in the pool, and there's so much you can do in the water. You can work on jumping and running, you can run in the pool. And as New Yorkers, everyone needs to work on their gait speed and walking faster, so we can cross these streets that have the short lights. And so I really encourage people, if you have a parent or you have a friend and you see that they're walking slower, or you see that their balance isn't what it should be, we all need to help each other avoid falls. And I would refer them um, to a physical therapist. Doesn't need to be us, but the pool program is a wonderful way to work on balance and to prevent falls.
Love that. Last thing we do, Carol, is we let somebody have a parting shot. If someone's watching this and listening to this, what would you want them to know? What would you want them to leave with? The overarching theme about why aquatic physical therapy is just so great.
I think aquatic therapy is great because when you get in the water, you always want to come back again, because it's so freeing and creative, it's energizing, and it just makes you want to move and be your best.